my name is Susanna and I'm the manager for The Natural Doctor. We've been sponsoring the talk tonight. So obviously the talk is by Dr. Eccles, so a few words about him. So he's the medical director of The Natural Doctor, as well as he specializes in bioidentical hormone therapy, treating menopause, breast cancer prevention, breast mammography. He developed his own breast mammography software, as probably a lot of you know, called ThermoCheck. There you go. As well as he created his own line of anti-aging prescription face creams, libido endorsement program, as well as hair restoration program. He's the medical director of the British Association, British Anti-Aging Association. And as well, he's been contributing to the medical field. And for that, he's won Who's Award for medical achievement. Before I say, let's give a round of applause to Dr. Nigel Eccles, I would like to remind you, we have a slot at the end for around 10-15 minutes for any questions. So if you have any questions, please just write them down, and then at the end, we can all answer that for you. I prepared as well little small goodie bags for you. You have little samples of our face cream developed by Dr. Eccles. There's a voucher in there as well, brochure, if you're interested of other things we do. Anyway, that's me talking for tonight. So let's all give a round of applause to Dr. Nigel Eccles.
I have a lot to present to you this evening. I would say that we probably need half a day to do this properly. Seriously, it's a big topic and a major challenge to take on better aging and hormones in 1 hour. So you'll have to forgive me if I hurry through some of the things that I'm going to present to you, because I want you to get the full flavor of anti-aging medicine, including some of the latest thinking, rather than dwelling on one particular thing. So you'll forgive me if this is more an overview of the subject rather than an in-detail workshop. Okay? If any of you are interested in that latter concept, doing a workshop and more detail, that's something we can look at doing at a later date if you express an interest to either myself or one of my staff. Okay? So happy to look at doing that. So we have about an hour. So as you heard earlier, please reserve your questions to the end. That will allow me to go through, record, and then I can tackle your questions at the end. So let me start by this. I have a neighbor, and every time I bump into her, I ask her, I almost hesitate to ask her, how are you? because what she usually says to me is, I'm fine, I don't need you. And actually, that is what she says to me. She says, I'm fine, I don't need you. But I haven't countered her with this yet. I feel like saying, you know, well, actually, you do need me. This woman is in her 60s, and why I'm bringing this up is there is this notion that doctors really are only there for catering for you when you have a problem, when you're sick, when you have an illness, when you need to be investigated. Whereas this whole topic that I'm presenting to you this evening is something a bit different. This is about the true concept of anti-aging is not about just looking good. It's not about having less wrinkles and looking younger. The true concept of better aging is how you prevent rusting from within, if you like. How you do something about the degeneration and the rusting that goes on as we age. Is there something that we can do about that? What causes those changes? What can we do about them? Well, fortunately, there are doctors called anti-aging doctors. And much as I don't like the term anti-aging, I prefer better aging. These doctors are ahead of the game in terms of keeping people well. How do you prevent illness? How do you stay looking good, feeling good, and being vital? And that's what this topic is about. It's sharing with you some of the things that I've learned over the last 20 years or so from studying better aging, and really just sharing some of those golden nuggets that I've come across. And some of them are reflected in some of the product developments that I've already achieved, which I'll talk to you a little bit about. So, I want to ask you a question. How would you define aging? And I can only give you 30 seconds on this. How would any of you, if you're brave enough, would you define aging?
How you feel.
How you feel?
Less well.
Pardon?
When you feel less well on a daily basis, you can't move as fluidly, you can't do things.
Okay, so you're describing a loss of function then, and maybe a loss of vitality as we age. Anybody else?
We talk about chronological versus metabolic.
Anything,
aging.
anything.
No, but I mean, people look at that difference between how old you actually are compared to how old your body is working.
Okay, so now you're alluding to the physiological processes that go on in the body that are reflective of how well and how vital you are. So that's looking at it at the biochemistry and the physiology rather than how you feel subjectively. Okay, now you're both right. So when we look at aging medicine, we need to embrace both, don't we? So here's what I think is a good definition of aging. And it embraces this concept of wear and tear. Aging is a decline in physiological functions resulting from cumulative damage to tissues that overwhelms the body's natural ability to repair them. That's quite a good definition. That is what we feel causes aging. It's when the degenerative process is outstripping the body's ability to repair. Okay? So let's develop this because we want to know what can we do about that. Well, this guy, John Turner, he's actually a psychiatrist. In this left picture, and this laser doesn't work very well on this, but the left picture he's 67, and in the right picture he's 79. So this notion that we have to get fat as we get older is simply not true. It depends how much you invest in the earlier years. So it is, I mean, if you took his head off, that left-hand picture, that physique could easily pass for someone in their 20s and 30s. Would you agree? Yet he's 67 in that picture. So here's what the problem is as we age, we have greater risk of degenerative disorder. And here you see the degenerative brain. So on the right-hand side, you see an Alzheimer brain. Look how shrunken that is and how there are bigger spaces. That's an Alzheimer brain compared to the normal on the left. And what this shows is that there is an increasing incidence of brain degeneration. We're living longer, but we're not living healthier, and we're having to face this degenerative change that happens as we age. Here in the brain, dementia and Alzheimer's. It's a major challenge. Now I'm coming back to breast health for a minute because it illustrates a point here. Here you have how a tumor would develop in time. Now, where you see, and maybe I can point to this because does that work? No, it doesn't. So here is where a mammogram would detect a tumor, okay? So it's about 10 millimeters or 1 centimeter in size. But really, by the time it's there, it's 500,000 cancer cells. It's been there for 6 to 10 years. But it's only presenting itself on our detection tool at that point. That's a problem, isn't it? Because it's not early enough detection. Really what we want to be doing is detecting back here. And that's where thermography comes in, because it picks up signs of a tumor when it's developing back here, not when it's fully established like it needs to be on a mammogram. But that concept is a major challenge in modern medicine. Why? Because we tend to detect processes, disease process, too late. What we really should be doing is measuring imbalances in the system that are leading to a disease process and correcting those abnormalities sooner. Would you agree with that concept? Yes. That runs, unfortunately, through modern medicine. We detect too late, we use the wrong tests that only tell us something is failing. So one of the things we have to change to do better in aging medicine is we have to do measurements which are not reflective of disease, but of an earlier disease process. What are some of the things that lead to aging that we know of? Well, free radical stress is also called oxidative stress, highly reactive chemicals which can damage our cells. Inflammation, virtually every chronic disease that you can describe, whether it's cancer, heart disease, Alzheimer's, can be linked to inflammation. Glycation, what's that? It's damage of proteins by things like high levels of sugar in the system. Because if you have too much sugar, it accelerates the aging process. We know, ladies and gentlemen, that fructose increases your glycation process 7 times more than glucose. So when you have a diet which is high in fructose or high fructose corn syrup, it causes 7 times more rapid aging than if you didn't have sugar in the diet. Now remember that, because that's one of the tips in terms of what you can do about aging process.
Do you include fruit when you say fructose?
Can we leave questions to the end? Mitochondrial impairment is important. That means as we get older, the cells can't produce energy as efficiently. So there's a mitochondrial decay. Those 4 in particular I've highlighted, and I'm going to talk more about hormone decline later on. Okay? All of these things we think are relevant to the aging process. These are the things that we need to be measuring so that we can correct any abnormalities or any propensities for those to be high. You follow me? Those are key processes, including hormones. So there's the mitochondria. There are many studies which show that as we get older, the mitochondria, which are the energy-producing organelles inside cells, they decline in function. Okay, so externally, this is how aging presents. Loss of structure and loss of function. Here you see it on the external. You've got loss of structure, loss of support, but the same process which is causing that degenerative change that we see on the outside is going on in the inside, which is why proper and true anti-aging medicine focuses on not just the exterior, but also what's going on in the interior as well. So this is part of the problem, is as we age, unfortunately as we age, we have age-related disease. What we're really seeking is the bottom line, which is that as we age, we have optimal health and we eventually just drop dead from old age, but without a disease process. But one sobering statistic I want to share with you is this. By the time you are 65 in Western society, you have an 88% chance of having a chronic disease. Just think about that. Very sobering. You have a 4 out of 5 chance of having a chronic disease by the time you are 65. I don't know about you, but I don't like those odds. And I'm interested in doing something about that. And that's why at my practice, it's focused a lot on prevention, a lot on measuring the right things so that we can take people off a degenerative path. So this is a bit more detailed, showing the same thing. And here what you see again is, that's the schematic you've just seen. What are the processes that contribute to these diseases that you see on the left? Because what you have here are Alzheimer's, diabetes, cancer, cerebrovascular disease, Parkinson's, osteoporosis, all the degenerative diseases, well not all, but the majority of degenerative disease we know. And what are the things that contribute earlier downstream to these processes? Inflammation, oxidative stress, mitochondrial dysfunction. We should add on to this hormonal decline. So what I'm saying is back here, these processes are very similar in all of these disease processes. And some of you don't believe me, but I promise you it's true.